Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neal Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neal Howe, and we are talking physical therapy again. This is National Physical Therapy Month. So we've been talking with some physical therapists. Today's guest is Barry Meklir. He is the owner of Muscular Solutions. He is both a licensed physical therapist and muscular therapist who has taken more than a dozen workshops and seminars on chiropractic applied kinesiology. He specializes in treating people with chronic and acute pain and dysfunction who have often received no relief from more standard medical care to live a pain-free life. Barry received his BA in biology from Boston University in 1988, his muscular therapy degree in 1993 from the Muscular Therapy Institute, and his master's in physical therapy from Simmons College in 2001. And he has been healing Boston by hand for the last 24 years. Welcome to the show, Barry.
Thank you, Neal. It's great to be here.
Well, I really like people that have been healing people. It's an awesome privilege to be able to make people feel better through physical therapy. But physical therapy to different people is something different. So let's hear what physical therapy is to you.
Well, a physical therapist is someone who is kind of highly educated with a graduate degree in physical therapy and is a licensed healthcare practitioner who often helps patients reduce pain and improve or restore mobility or overall function, sometimes without surgery, sometimes after surgery. But there are a number of facets of the profession, from orthopedics, both immediately post-surgery or kind of an outpatient mode, where they aren't in surgery, don't go to surgery, or helping patients that might be in a geriatric home with severely limited mobility, or working in more of a respiratory model for patients that have lung congestion and things of that nature. So similar to being a physician, there are many kind of different variations of the profession.
Yeah, I think that's something that people don't realize is, like you said, physical therapists are highly educated. There's a lot of years that go into studying the body. Obviously, movement is the main thing that you help people increase their movement and be able to move better. And that involves pain as well, pain relief. I'm not saying that you inflict pain, but what area of physical therapy do you practice most?
Well, I have a very non-standard medical practice. I work only outpatient, and I specialize in treating, as you said, chronic and acute pain and dysfunction. I work one-on-one with my patients for an hour at a time, and 90% of my practice is manual. So rather than having patients come to me and I put ice on them and then some ultrasound or stim and then have them exercise, I am working directly with them with my hands using a variety of techniques to align, balance, and integrate their overall function and thereby reduce pain and restore motion. Because I do not take medical insurance, I'm not limited to treating only one specific area of the body or one specific complaint. So often I'll be treating patients that have multiple areas of pain and multiple complaints, which I treat all as one thing.
So explain that to me, what you just said about because you don't take insurance, you can treat the whole body rather than one area. That seems absurd to start with, but explain what insurance limits you to do.
Sure. Well, because most physical therapists are paid through insurance, there's a lot of documentation that needs to occur. But for instance, when they're treating low back pain, they're really focusing only on low back pain. They're not focusing on shoulder pain or neck pain or knee pain or ankle pain that may either be causing the low back pain or may be coming from the low back pain. So they really need to treat the person only as if they have low back pain and no other problem. While they, I think, are legally allowed to work on, let's say, a shoulder, they won't necessarily be able to bill for it or get paid for it.
So that really is absurd. So you're not necessarily solving the problem in that case. You're just fixing what you're paid.
I agree.
To have a look at, which doesn't make sense for the patient at all.
Yes, you wind up treating symptomology or a diagnosis and not necessarily people. Moreover, Neil, very often where someone is experiencing pain isn't necessarily where the points of causation are coming from.
So explain that to me. What challenges are people coming in with that come to see you?
Let me give you a very direct example. Like most other physical therapists, I treat half of my patients or more have low back pain. I also treat a lot of runners, whether they're training for the Boston Marathon or just running for fitness. All the runners that see me that have bad feet come to me with low back pain. All the runners that have good feet or no foot problems or ankle problems, they're coming to me for other issues. Think of it this way, to use an analogy. If you have a flat tire and a bent rim and a bad shock, you're going to get a very bad ride. And that feeds all the way up through the person in the car. And the same is true for your body.
So a lot of times back pain is actually caused by bad feet rather than, some pull in the back or some exercise that you may have been doing that is causing that back irritation. It's not necessarily the back that's the issue, it's the feet. Is that correct?
Sometimes. In other words, the back does have an issue, but a big piece of causation can be actually in the feet. And despite strengthening the back and doing all these other things to help the low back or the pelvis as just a single unit, other things are being neglected. See, Neil, most people that really hurt their back or go into spasm, they don't do it lifting a heavy weight. They bend over one day to get their shoes, and then they don't get back up. Their back goes into spasm. Mm-hmm. So it's caused often by repeated micro trauma with many different points of causation. And more standard physical therapy is just worried about treating, or often just treats, the symptom, the back pain. I'm trying to treat everything that's causing that back pain, as well as trying to figure out what the person is doing in the context of their life that can be exacerbating and potentiating that problem, even if when they do those things or those habits, it doesn't cause pain. As a matter of fact, some of those things may be extremely comfortable. But they're comfortable from a place of having done them so much or being used to them and being habit patterns rather than them being beneficial.
So what kind of people do you see? You mentioned runners, obviously. A lot of impact, a lot of repetitive action and habits. Is that a large portion of your clientele? Or is it more the person who is working a day job that might be a little bit strenuous and they're doing the same actions over and over? Or is it people who are sitting at a desk that have bad posture for 8 hours a day and have issues from that?
Sure. So actually runners are a small percentage of my practice. I just was using them as an analogy. I actually treat all sorts of people from age about 12 up into their 80s. I see people that have any area of pain that I can basically touch, be it ankle pain to chronic headaches or temporomandibular joint syndrome. People usually come to me because either they've had no success going through more standard physical therapy or medical care, or they have just heard about me directly from friends or kind of in the more alternative medical world.
So you say you're hands-on and you're healing Boston by hand for the last 24 years. What exactly does that mean, healing by hand?
Sure. It means that, like a massage therapist, my hands are on you for the majority of this session. And I'm using various soft tissue techniques, such as myofascial release or muscle energy or connective tissue release or strain counterstrain, trigger point work, as well as also mobilizing or adjusting joints like a physical therapist or a chiropractor or an osteopath to align, balance, and integrate the body as a functional whole.
So there's a lot that goes into physical therapy. You've got a little bit of chiropractic, massage therapy. There's, a whole list of things that you look at and are able to do. Why don't more people, do you think to go to a physical therapist first before maybe a massage therapist, a chiropractor, or even their medical doctor?
Sure. Well, there are many questions, actually, or many answers within your question. First off, compared it to my practice, I'm very, as I told you, non-traditional or non-standard. I'm the integration, actually, of physical therapy, massage therapy, chiropractic, and almost old-style osteopathics. So I work in a way that's very different from most other practitioners. In order for patients to get their physical therapy covered, they usually have to first go to a doctor. Sometimes when they don't want to deal with that, they start with massage or chiropractic. So it depends on the person and the problem they're complaining of. Some patients will go to PT while they go see a chiropractor or get massages on the side.
So what other misconceptions might there be about the physical therapy industry?
Neil, that's actually a tricky question for me, to be perfectly honest, as I'm a bit outside of the standard PT world. I think one of the misconceptions might be the amount of time that they think a PT is actually going to be able to spend with them within an appointment. In most standard outpatient orthopedic clinics, the physical therapist is spending not a lot of direct time with the patient, because often they're running multiple patients at the same time. And while they could be working directly with one person, they may have another patient of theirs exercising and another patient receiving ice at the end of a treatment. They also might be surprised about how little physical therapists actually touch them directly, or how much of the physical therapy is going to be about exercise, the exercises they're going to do directed by a physical therapist.
And how often, I know every case is different, but how often do people go to the physical therapist to do work rather than do the exercises that you might provide them at home?
Well, again, Neil, with respect, those are two different things. Most patients see a physical therapist when they're on a medical script for 2 to 3 times a week for a certain number of weeks, depending on the case. And it may get reduced to once a week. And they're given a lot of exercises to do at home. With me, because my patients pay me directly out of pocket, I'm very quick to tell them that if they do what I tell them, they're going to feel better and feel better faster and pay me less money. And most people really like that. So I try to give them an exercise or two. I don't wish to overload them, and wish to demonstrate to them in the office how it will truly help them, to motivate them to do it much more consistently.
So most people that see physical therapists right now have to go through a doctor. Is that correct?
If they want to have it covered by their insurance, yes, that is correct.
Okay. So let's talk about some of the other fears people might have when seeing a physical therapist. What fears are there? Is there going to be pain involved?
Yeah, I think pain is always a bit of a fear. I think another fear might be either the time commitment or the cost, or that they won't get better, or that it's a waste of time.
But ultimately, going through these range of motion exercises and really diagnosing the problem, whether it causes a little bit of uncomfort for a while, it's all about getting better and increasing the standard of living, right?
Absolutely. But it's what I call therapeutic pain. It hurts a little, but the patient hopes, thinks, or prays that I'm helping them or another physical therapist is helping them. And let me be clear, standard physical therapy helps hundreds of thousands of people a year.
Mm-hmm.
It's just that my practice is very non-standard.
Okay, so if somebody is dealing with chronic pain, what point do they have to get to make them say, all right, it's time to go see a physical therapist?
Usually after an acute flare-up, they first go in and start seeing a physical therapist after seeing a doctor. It's after having multiple flare-ups in multiple locations and going to physical therapy or chiropractors or standard massage a number of times and not really getting better, do they then often try to seek me out.
And give me an example of how you've been able to help somebody through physical therapy. What condition did they come in with? What were you able to do for them as far as your healing process? And how did it change your life? What was the outcome?
Okay, so I'll give you a recent example. A woman contacted me a few months ago who heard about me through a friend of hers, who is a friend of mine. And she lives about 2 hours north of Boston. And she told me about her son who got into a fight, who was, he was 14 or 15 years old, who got into a fight in school. He was being bullied, and he protected himself. And as he turned away, the boy bullying him hit him with a hard object in a sock and gave him a concussion. Since that time, he's had a chronic, unrelenting headache. He'd been to numerous neurologists and physical therapy and various other practitioners, and not only did they find nothing wrong, he got no relief. Upon speaking to this woman and realizing she was 2 hours north and not being able to sync our schedules, I told them if they came down from New Hampshire, I would come in on a Sunday and treat their son for 2 hours and try to get as much done as possible. So they came down from New Hampshire, and I saw that young man. And in 2 hours, I did a bunch of work in kind of aligning his pelvis and doing various other things with his neck and shoulders, as well as his cranial bones and other things. And he left my office with no headache. It has never returned.
Well, that is really amazing to, have a concussion and have a bang in the head, and then all of a sudden in 2 hours after having that chronic pain for a while to have it just disappear and never return. Explain to me, you said you dealt with his pelvis and the neck area and other areas of the body. Explain to me what you found in that instance that, really helped heal him rather than just looking at what was going on in his head.
Well, as far as I can remember, Neil, what I found was that he had misalignments throughout his pelvic structure with one ilium rotated anterior, another one posterior. a little bit of what's called a pubic shear, or his pubic bone being off, his sacrum having a left-on-left torque, so a twist, and that filtering all the way up to his spine. Think of it this way: if the foundation of a house is bad, the roof will most likely leak, even if it's new. So fixing the pelvic structure helps as a beginning place to start aligning the spine and putting the neck in a better alignment, because ultimately we're all bobblehead dolls. We kind of, our head kind of floats on the rest of us. So I aligned his pelvis, and then I wanted to start to balance out the soft tissue structure and the torquing throughout his whole entire system. And after I got things to a place of kind of balance and stability, I could then work more directly on the actual blow to the head and the actual direct symptomology. Because
so these were kind of
would be better from it.
Okay, so these were kind of underlying conditions that were there before he got the bump in the head.
Maybe.
And or
maybe. I can't be sure which was first.
Mm-hmm.
And at some point it doesn't matter. Because in general, when someone has chronic neck and shoulder tension that's unremitting, you're going to find problems in the pelvis and tightness in the gluteal muscles and the psoas muscles in both the anterior and posterior of the body. And balancing out that area immediately helps release the whole erector spinae group up the spine and starts to loosen the neck.
So there's a lot of issues, obviously, that can be sought out by a physical therapist. How often should somebody go to a physical therapist, even for a checkup, to make sure that some of these chronic pains and movements are taken care of before they become major issues?
Well, again, since patients are usually trying to get covered by medical insurance, they're usually going to doctors for checkups or with a complaint of pain, who then assigns them to go to PT or prescribes them physical therapy. In that concept, patients go to physical therapists whenever they're in pain, because rarely do they want to pay out of pocket. My patients come to me whenever they want, because they are paying out of pocket. They get treated for either whatever problems they tell me about are going on, or sometimes they come in for what I consider, quote unquote, a tune-up. They're feeling pretty good, but things are starting to tighten up or be achy, or they're just noticing slight increases in dysfunction and just want to feel a bit better.
Mm-hmm. So prevention is a lot better than rehabilitation.
Absolutely. And one of the keys to really good prevention is proper posture, proper ergonomics. In other words, good form. In whatever sport you pursue, as you're learning a sport or being taught a sport, form is always emphasized, because that form gives you a lot of power and ability. And the same is true in just daily life. Function and how we do things with proper form really matters. Constantly bending over and not bending your knees creates a micro trauma that eventually adds up, causing problems. Simply bending your knees a little bit makes a huge difference.
And these are all things that can be told through education by a physical therapist. So, prevention, or just going in for a checkup or a tune-up, like you say, is definitely going to be better for you in the long run, rather than waiting until you have that injury or that chronic or acute pain that really makes you want to, make an appointment right away. So,
absolutely. I mean, patients could choose to go to any physical therapy location and pay for it themselves and just ask for an evaluation and a general idea or plan of what will make them feel better or perform better. But I don't know too many patients that do that. But it is possible.
Mm-hmm. Well, tell me, Barry, what got you involved in the physical therapy industry in the first place?
Well, Neil, I originally actually wanted to be a cardiothoracic surgeon when I was much younger, and was pre-med in college, and decided I didn't want to spend another lifetime in study, and didn't like where the medical field was going as a whole. And after suffering an acute shoulder dislocation, it was actually a massage therapist that really helped heal me. And so I looked into going to massage school while I was working in a laboratory doing medical research. And after doing that, and then spending years in my practice, as well as studying with AK chiropractors, I wanted a bigger box of knowledge and licensure, and I didn't want to leave Boston, so I looked into physical therapy.
Well, I'm sure people in the Boston area are very glad that you did. You've been serving the Boston area for 24 years. Any last thoughts before we go, Barry? Any steps people can take to, keep themselves in best health as far as physical therapy goes?
Sure. Well, the best and most important thoughts I have for people in general is having someone teach them good posture and proper ergonomics to make sure that their workstations are set up accordingly. If they're at a desk, if they're doing more of a physical trade skill like an electrician or a carpenter, the more that things can be done again with kind of proper form and body mechanics, and in a balanced manner, the better.
So no shortcuts.
There really are no shortcuts. It's if you're getting out there and living and moving, eventually you're going to need a tune-up.
All right. Well, great, Barry. I really appreciate you spending time here with me today. For people in and around that Boston area, how do they get in touch with you? What's your website, phone number, email, whatever you want to give here?
Sure. Well, patients can find me on the web at muscularsolutions.com, or call me directly at 617-566-8986, or send me an email, which would be at barry@muscularsolutions.com.
Well, excellent. We've been speaking with Barry Meklir. He is a physical therapist in the Boston area. If anybody's in Boston listening, make sure you go and see Barry, even if it's just for a tune-up, to make sure that you are in peak physical condition and you don't get any injuries that you don't need. Well, thank you again, Barry, for being my guest today.
My pleasure, Neil. Thank you so much for having me.
And to our audience, if you like what you hear, hit that like button, share, and we'll see you next time in the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show, or to listen to past episodes, visit businessauthorityradio.com.